Hello, everyone. Andy Jacob here with the DotCom Magazine Entrepreneur Spotlight Series. I have a fascinating show today. At the DotCom Magazine, everyone that watches the show, you know that we're so interested in health. We're so interested in healthcare, of course, through the pandemic. We have saluted all of the nurses and the healthcare workers and the doctors that are working so diligently to help so many people, not only throughout the United States, but throughout the world as well. We salute them every day of the week, 24/7, 365. And of course, we know what's going on in healthcare. We're all very attuned to it. And my team brought a very interesting entrepreneur across my desk. Her name is Miss Nikki Boyd, and she's the CEO of Mahaba Healthcare. And let me tell you, she's built a great business. She really helps nurses really take the first crucial step toward finding other opportunities, other places, other facilities where perhaps they want to go sort of put their expertise to use to help those facilities. Nikki, it's so great to have you on the show. Welcome to the DotCom Magazine Entrepreneur Spotlight Series.
Thank you. I appreciate it. I'm happy to be here.
It's great to have you. Okay, Nikki, let's go. I have so many questions for you. You're doing so much great work. I mean, so many people are reaching out to you. So many people now in your field have heard about Mahaba. It's really becoming a leader in the field. Let's pull the lens back to 30,000 feet and tell us about Mahaba to get started, and then we'll get going here.
Yeah, thank you. So Mahaba Healthcare is a nursing staffing agency. So basically what we do is we send nurses nationwide to facilities that are short-staffed. And as you know, many facilities are short-staffed these days. So we send nurses to hospitals, nursing homes, clinics, just anywhere where they could be used in these facilities where these places need extra help.
Yeah, it's so interesting. This morning I woke up and there it was right at the front page of my news alert that so many hospitals are having a tough time. So many healthcare facilities are having a tough time with their nurses because there's just not enough to go around. But one thing I love about what you're doing is, like the sign says behind you, you're driven by love. So let's talk about that. What type of nurses reach out to you? What do they say? What's that conversation sound like? Why do they want to move to the next sort of, transition in their professional life?
Yeah, absolutely. So a lot of nurses reach out because they want to change. They want something different. They kind of want to help out with what's going on. So they call us to ask like, hey, where can I go to kind of put my expertise to use? And also too, it's money driven. You get paid a little bit more for traveling to these other locations. So that's always a plus when they decide to go on these travel contracts throughout the nation. Nurses are very compassionate caregivers. So when the need is greater, say in New York or California, these nurses have a compassion for these patients and they want to just go and help and put their expertise to use.
Yeah, it's so powerful. I mean, when you think about it, they get to potentially get more money, but then they get to put their passion to use in a different part of the country. So let's just say I'm a nurse right now and I'm working in a state, and I say to myself, not only would I perhaps like to make more money, but, I don't mind moving. I know that there's a certain part of the country that needs me, and it might be a cool thing to sort of live in a different part of the country as well and experience that. Is that sort of the idea behind what you're doing at the company?
Well, yeah, kind of. So these nurses actually leave their families at home where they're from. So let's say they're from, say, Arizona, where I am. They leave their families and their friends in Arizona. They pack up a suitcase and they go to New York. They hang out in New York for a few weeks to help out. And then they finish their contract and they either go to another location or they come back home to Arizona. So these nurses are in these other locations, basically just, helping out without family and friends around. It's a completely new environment to them. They don't know anybody. They don't know the facility yet. So they're really just basically starting from scratch, so to speak, and helping out the facility until, they're either no longer needed or decide to go someplace else.
Wow, that's so interesting. Let's talk about the contracts, because you mentioned they could just leave for a couple of weeks, go to the next contract, come back home in your example. How long are these contracts typically for these nurses that, you've been helping out so well throughout the time that you've had the company?
Yeah, so contract lengths vary. They're anywhere from 4 weeks to 13 weeks or longer. The nurse has the choice to extend the contract if the opportunity is available. A lot of times, the facility will absolutely appreciate the nurse extending the contract. A typical contract pre-COVID is about 13 weeks. Right now, during COVID season, contracts can range anywhere between 4, 6, or 8 weeks because they just really need the help. And if they can get you short term, they'll take it, but they would appreciate it if you stayed a little longer.
It's so amazing. You work with so many nurses, and, I'm not in the medical field. My wife is not in the medical field. I have a lot of friends that are not in the medical field, but of course, friends and associates who are. But what's the thing about nurses? I mean, when you think about how compassionate they are and, they want to help out and they're so driven to go do good in the world. When you talk to these nurses, I would imagine it's a great way to wake up in the morning knowing that you're going to talk to so many great people.
Yeah, absolutely. I mean, as a nurse myself, I can kind of speak on this. You either have it or you don't. You want to do this thing. So you go to nursing school and you're like, I want to help out. I want to be a caregiver. I want to be able to help people essentially try to get better. And so you give it your whole heart. You go and help out in these different facilities and you're like, I'm here to make a difference. And it's very rewarding to see your work in progress when you see these patients get better or when they don't get better and you're there to hold their hand as they transition. It's just very rewarding.
Yeah, it's so powerful. What a great way to wake up in the morning knowing you're doing so much good for not only your clients, but for the communities of which they serve and the communities that they're going to. Now, so you mentioned they have these contracts, okay? So in this example we were using, you're in Arizona, the nurses in Arizona, let's say they go to New York, okay? It's a little colder in New York than it is in Arizona right now this time of year, but they get there. How do they figure out like where they're going to stay and what, where they're going to live and, what to do when they're not, being the great nurse at the new facility? Who helps them sort of land on their feet in the new city?
Right. Great question. So it's kind of twofold. Some nurses like to be independent and figure all of it out on their own. As a traveler myself, I like to go to a place, figure out where I'm going to live because I travel in my RV. So I like to find a spot for my RV to park. I like to find my own hangout spots and food places. However, as a company, we do provide that information for the nurses if they need it. So we'll provide some suggestions on where they can live. We also try to provide a list of different places where they can eat. And then a lot of times when they get to these locations, they link up with other nurses who are local, who will tell them about hangout spots, and things to do off hours. But during these contracts, you're so tired. Usually during your off days, you're just kind of sitting around hanging out, sleeping, eating. But yeah, we help them if they need the help. But if not, they just kind of wing it on their own a lot. And that's the thing about being a travel nurse. You kind of have to have that level of independence, to be able to go out there and kind of fend for yourself, because sometimes the answers are not always obvious. And you have to go out there and kind of figure out like, hey, what's my next step? What do I need to do to be successful during this assignment? And so that makes it kind of exciting for me as a travel nurse. Some people get anxiety, but as a company, we try to keep down that level of anxiety by helping out as much as we can.
Wow, I love it, Nikki. You're doing such a great job at Mahaba. Now, let's say a nurse is working at a hospital on the West Coast. Okay. And let's say they reach out to you, they've heard what you're doing. I mean, I love what you say. We are nurses who hire nurses. I mean, there's nobody that knows nursing better than a nurse, and there's nobody that could probably relate to a nurse better than a nurse. So that's why this company just resonates for everybody at DotCom magazine. But so they work at a West Coast hospital. Now they decide they want to go to New York, like you mentioned. Are typically hospitals, do they kind of function the same way where the nurse can just go in and get fit right in? Or are all of these hospitals operating a lot differently where it's kind of, a little different for the nurses depending on which hospital they go to?
Yeah, each hospital is definitely just a little bit different. Even the culture of the location is a little bit different. But just to step back some, before we even go to that location, we have to make sure that the nurse is credentialed to even work there. So there are a few states that will accept a nursing license from wherever. So we have compact states in the nursing world, which means that about 29 states will allow you to work on the same nursing license. So like Mississippi, Tennessee, Arizona, if you have a license from any of these places, you can can go and work there. But let's say you want to go work in New York or even in California, and you're from one of these states, then you first have to apply for a license there. After you get your license there, then you can go and work at that location. And like I said, each place is slightly different. Nursing care is always the same. You always care for your patients the same way, no matter where you go. But the setup of the hospital may be different. The size of the hospital may be something you have to get used to. The doctors there might like to do things a little bit different, and you have to adjust to that. Even the culture of the nurses there, nurses in the South hold one culture, that Southern hospitality. And then you've got that New York culture that's kind of fast paced, so you just kind of got to get used to that. But once you do and you learn these things, I think it's pretty cool. I've always enjoyed it.
It's a great challenge for the nurse as well to go to a different environment. It's a great way for them to grow and become better in their field as well. Now, you work with so many top healthcare facilities. You work with, also, community healthcare facilities as well, and everybody in between. Let's talk about sort of the chicken and the egg. So is it the healthcare facilities that reach out to you and say, hey, we need nurses? Or is it the nurses that reach out to you and say, hey, we need a healthcare facility? Which one comes first, and how are you able to keep that balance?
Yeah, so we work with both. The facility will reach out and the nurse will reach out, and we play that middleman. Like, hey, facility, we have a nurse who sounds like they'd be a great fit for what you need. Or we'll tell the nurse, hey, it sounds like you need blank, and we have a facility that can help you out with that. So we try to marry the two. We try to make a really good relationship, a really good connection, depending on what it is they both need. So if a nurse is a hospital, usually likes to work in a hospital, and like, I will never work in a long-term care facility, we wouldn't send that nurse there, and if a long-term care facility was like, hey, I want a nurse who's been a nurse for 3 years and knows how to do XYZ, then we would only send that type of nurse. So we try to marry them based on their needs.
Yeah, that's a great answer. And it really, really works so well. So let's talk about corporate culture a little bit, because we always talk that it starts from the top. Leaders always sort of set the standard for their company. When you wake up in the morning, Nikki, what's the standard that you're trying to represent for all the nurses that you represent, all the healthcare facilities that you work with, and of course your company as well?
Absolutely. First and foremost, I want all my nurses to know that they are not just a number to me. I absolutely appreciate and care for every last one of them as if they were my own sisters and brothers. So that's very important for me. And I really want them to understand that and know that. So I take the time out to call and ask how they're doing. Even as the CEO of the company, I'm not the primary recruiter, but I want them to know that I'm not so far above them that they can't reach out to me and talk to me if they need to, as well as my employees. I try to make sure that they know that they're appreciated, giving them Christmas presents and bonuses or whatever it is, to let them know that I definitely appreciate the hard work that they put forth for the company. And so I want us to feel like family. I want us to be comfortable enough to have those hard conversations as well. Like, hey, Nikki, this didn't work for me, and I didn't like this. And I want to be able to address that and work on it, So I don't want it to feel so rigid that they want to leave and go somewhere else if there's an issue that we can fix internally.
Yeah, that's great. I mean, do you ever get a time when you place a nurse into a city and, they're kind of a stranger to the city, and maybe they reach out to you, text you, hey, Nikki, I'm here in New York, I need to talk to you, I'm maybe a little unsettled, or I need some help, or I need some advice, or just need someone to talk to?
Definitely. First and foremost is always the nurse's safety. If they ever get to a location and they feel unsafe for any reason, whether they feel unsafe with nurse-patient ratios, if they feel unsafe because maybe it's a hard thing to talk about, but maybe if they feel like the place is a little racist and they feel unsafe that way, if they feel unsafe because there's just so much crime and they're like, no, this is not for me, then we try to make sure we get them to a more comfortable place. If they're willing to rough it out, okay, but we check on them a little more. If not, then we have to let the facility know, like, hey, for whatever reason, our nurse is unsafe. Thank you for this opportunity, but we're going to have to pull them out and send them somewhere else.
Makes sense. Yeah, that makes sense. And you're there for them every step of the way. I'm sure they have your cell phone number and your text
Definitely.
number. And I'm sure you're talking to a lot of people around the world. Now, listen, around the United States. So let's talk about these competitive rates. are the contracts hourly? Are they weekly? How do nurses get paid? I mean, I know it's a basic question, but I'm curious about it.
Yeah, so we pay our nurses every Friday. They get paid hourly. Nurses work anywhere from 36 hours, which is a full-time week, from 36 hours to 60 hours a week, which is a lot. I don't know how they do that. I never work 60 hours. I'm like, oh my gosh, I'm tired after my 36. But they do get paid hourly. After 40 hours, they do get an overtime rate in most states. In California, they get an overtime rate after 8 hours and also after 40. But so we do pay them hourly, and we negotiate those rates with the facility, try to get something that works for the facility and the nurse. And then we just kind of move forward from there. Yeah. Every Friday they get paid.
That's great. Every Friday. Now, do they get paid directly from you or directly from the facility?
They get paid from us. So the facility pays the company and the company pays the nurse.
That's a great model. So, obviously you've got that part of the model as well. So it's not just doing such a great job with the nurses, but you have to make sure the technology platform and stack to get these people paid on time for the right amount of money, is integrated in the right way. Man, you've got a lot on your plate as the CEO of Mahaba. When we think about right now, the different types of nurses. So, for example, I know that there's nurses that are in the intensive care units, and there are nurses in different parts of sort of the hospital. And there's nurses that are not even working in hospitals. They're working at doctors' offices. Who gets paid the most? Which nurse is the most, in-demand nurse right now?
That's a tricky question. It depends on the location. Almost every facility, meaning hospital, will accept an ICU nurse. I am an ICU nurse myself by trade, and they tend to get paid a little more than any other type of hospital nurse because of the level of training they have to have. But then you also have nurses who work in other parts of the hospital, such as the cath lab or the PACU, and they get paid a pretty sizable rate as well. It just really depends on what the facility needs and what they need in that particular location. With an ICU nurse can work a step down unit or telemetry unit. Some nurses can't go up though. So like a med surg nurse would not work telemetry or ICU. So they kind of like to use ICU nurses because we can go all the way down. You'll notice on my website, it'll say, hey, we really would appreciate if tele and PCU nurses would reach out to us, but we hire whomever. We take ICU, med surg, we staff in hospitals and other facilities as well. We just want tele and PCU nurses to know that we do appreciate them and kind of flock to them first before we reach out to ICU or med surg nurses, but we do staff whatever specialty.
Yeah, that makes sense. And if I'm a nurse, I can go on your website and I can actually browse through the open positions. Now, if I see something that sort of interests me, then I just, through your website, sort of reach out through there, and then the engagement begins and the process begins. Is that the way it works?
Absolutely. But all of our jobs are not on our website. So even reach out if you don't see something that you like, because we might have something for you, but just haven't put it on our website yet.
Yeah, that makes all the sense in the world. So when you speak to hospitals, I'm very curious about this. Who are you speaking with? Are you speaking with the hospital administrators? Are you working with their C-level executives? Are physicians actually calling you? Who's calling you from the hospitals?
We're speaking to hiring managers. So whoever that might be, at one hospital, that person may be somebody in HR. It might be a nurse manager. It might be a director of nursing. It just depends on that facility and how their structure is set up. But we want to speak to that hiring manager because we want that person to sign with us and get this contract started with one of our nurses.
That's interesting, Nikki. Let me ask you kind of a funny question. It might be interesting to our viewers. It might be something thought-provoking. One thing about you that certainly comes through and shines through is this beautiful smile that you have. And I think about, being in the hospital when the nurses come in the room and the doctors, when they give you a nice smile, it just makes you feel so good that, it's ingratiating and that, that you're with a person that's really going to take great care of you. But now everybody's masking. what effect has that had? I'm just curious, sort of on the mindset of the patients when they don't get maybe to see the smile from the nurses.
Yeah, that is a good question because we've wondered that too. I mean, you can kind of see a smile through the eyes, and you can tell a person's smiling. But we sometimes wonder, like, for patients who can't really speak on it, how do they feel when they see us in these masks, especially for somebody in the ICU, they're sedated and intubated. We wake them up and they're in this strange place with these people wearing masks and they're like, what in the world? But we try to make sure we still have calming voices. We use nice, gentle words, still let them know that we're still kind, compassionate nurses, even though they can't see our smiles behind our masks.
Yeah, that's a great answer. And you can't see if somebody's smiling actually with the mask on. So that's great. Let's talk about, before we get to entrepreneurship, which I have a great question for you. Let's talk about healthcare for the healthcare workers. In other words, these nurses, these doctors on the front lines, I mean, they're putting in sometimes 16 hours a day or longer. I mean, I've heard stories 24 hours a day without a break. How do we take care of their healthcare? I mean, they get done providing the healthcare. Now, I would imagine that they themselves need at least some mental health care to sort of keep themselves together and keep themselves, on a keel that allows them to provide this great, service that they provide. So what's going on in the field right now with sort of the healthcare of the healthcare workers? How do the nurses keep their head where it needs to be after they go through such a tough day, especially during this pandemic?
Yeah, that's a very thoughtful question of you. Healthcare workers are notorious for not really putting their own health first. We work long, extensive hours and days upon days in a row, not really putting our own health first. As a result, we do suffer from mental health things. We suffer from, medical issues and stuff that we haven't really tended to. It's a difficult question because while there are resources out there for us, such as my company, we do offer health insurance. We don't always take advantage of those things that, we have and try to take care of ourselves. One thing I would like to implement in my company as we continue to grow is I would like to bring on a person who can speak with my nurses about their mental health and just call them up a couple of times in a month and say, hey, how are things going? How are you mentally? Because we don't put enough focus on that. Just speaking from my personal experiences, when I first got called to do COVID contracts last year, I didn't know what I was getting into, and it was a lot to deal with. I saw so much death, unfortunately, and I didn't really know how to deal with that mentally, and I didn't really know where to go to get that help. And so I kind of had to work through that on my own. Unfortunately, some people can't work through that on their own, and they need that help. And I would like to implement a program in my company where I can provide that help to the nurses free of charge, where the company pays for that and the nurse gets the mental health that they need.
Yeah, that's a great idea. And that's a great strategy, of course. And that's a great answer. We need to take care of the people who take care of us. Now, Nikki, before we go, and I know you've only sliced out a certain amount of time today, and I thank you so much for that. I want to talk to you about entrepreneurship because you're building this company. You're nurses who hire nurses. You're a nurse yourself. You're driven by love. I mean, I love the whole thing. Let's talk to the younger entrepreneurs watching the show who are, getting off the ground. Maybe they're hitting a pothole in the road. Maybe they're hitting a roadblock. They don't know what to do to get through it. Maybe they're freezing in the frame a little bit. Can you give some advice to the entrepreneurs watching the show about what it takes to get through those tough times as a business owner?
Yes, absolutely. It definitely takes patience. It takes a lot of patience, and it takes confidence. You really need to believe in yourself to know that what you've started, you can work through and finish. And it takes also too a support system. Even if you have one or two people that you can kind of talk to and confide in, and maybe not tell them your strategies because you don't want them to take your ideas, but at least let them know how you're feeling mentally. Mental health is so important. And then also too, a mistake that I've noticed some of my peers make is they go into entrepreneurship, but they quit their jobs before their business can support their bills. And so if I could give anybody any advice, make sure that your business can support your bills in the very least before you quit your own job.
I got it, Nikki. It's great advice. It's sort of like do the night gig, do the side gig until that sort of is able to cover things and then go in full force and make it happen. It's great advice. Nikki, this has been a great interview. I need to bring you back on the show, as you continue to grow, as you continue to evolve. I love this strategy of bringing in a healthcare professional to help the professionals with their healthcare. I mean, I can't say that 3 times in a row very fast, but listen, what you're doing is great. This We Are Nurses Who Hire Nurses is a great position for the branding and the marketing experts out there. Look at that, because she's really positioned it very, very nicely. And what you're doing at Mahaba is fantastic. So, Nikki, I wanted to take a minute just to thank you so much for coming on the show. Of course, we appreciate you so much at DotCom Magazine. We appreciate all the nurses, all the healthcare professionals, especially through this tough time. And certainly we see some light at the end of the tunnel for everybody. And we certainly know that the nurses have been a great big part of this future of success that we're all about, hopefully, to attain. So thank you so much, Nikki, for coming on the show. And you've been a remarkable guest.
Thank you, Andy, for this opportunity. I really appreciate it.